What's up guys, Dr. Tyrell Detweiler here with Hybrid Performance Group. We're going to go ahead and show another technique that we utilize dry needling for. This is going to be a little bit more stimulus, and we're going to utilize this primarily on bigger muscle groups like the traps, quads, hamstrings. So this is going to be called pistoning, in which we're really trying to increase a lot of blood flow, a lot of stimulus into the tissues. And specifically for the traps is a really good method to get those tight traps, kind of help out with those headaches, all that good stuff. So we're going to show you what that looks like here. Basically, I'm going to utilize my needle and we're going to grab a piece of that trap, right? And basically we're going to go straight through on that trap to try to get a response from the tissue. So as we find the tight spots in our tissue, we're just going to insert, and you can kind of see how that muscle twitched. There you go. This is going to be a little more stimulus, which means it could be tight or a little tender in here. But as we know, a lot of people hold a lot of tension in our traps, and this is a very important place to go into and make sure we're releasing. So we might see Jacob twitch multiple times. That's actually a good thing. That means we're getting in and stimulating the muscle and making it contract and actually relax. So that's pretty good. He's not twitching anymore. Again, a lot of times these traps are going to be very commonly involved with headaches, so we always want to come in here and just make sure that we're getting those common things addressed, right? Common things happen commonly. Traps are always a go-to for stress, headaches, shoulder issues. And actually from the first needle, he's not doing too bad anymore. Not a whole lot of twitching going on. So that's a good thing. His muscles are probably starting to relax a little bit. How are we feeling, Jacob?
Pretty good.
Pretty good? Awesome. All right, so I'm going to switch over to the other side here, and we're going to take a chunk of tissue, just like before. And I can actually feel that twitching. You may not be able to see it, but I can feel it with this finger twitching. Good. Another one coming here. Good. So really not too bad on the twitching. That's totally fine. What we're going to do is we're going to leave these needles in. Once we get done pistoning, we get the stimulus we want. We're going to leave them in for a while. We're going to twist them a little bit, and that's going to allow that tissue to grab around the needle and get us a little bit more stimulus, a little bit more healing. We're gonna actually start to see this pool up a little bit with some redness that tells us we're getting blood flow. All that are great things, and it's telling us that we're getting some recovery into these tissues, and then he's definitely gonna feel some relief from this. So typically leave these in until they decide that they wanna come out. Once that tissue is attached to the needle, it's gonna feel like I can't pull it out. So we always wanna wait to allow that tissue enough time to relax, pull straight out, and he'll be good to go.